Hi everyone, Dr. David Kulla here with Synergy Wellness in New York City. We have Edwin here. Edwin I think he's in the position millions of you guys are in, okay? I'll let you explain. Go ahead.
I have a hiatal hernia at 3.5 centimeters, so he's trying to adjust it to prevent surgical procedures. And basically, it's good revolutionary steps to prevent doctors from digging into your insurance and making you go through surgery, which can complicate things down in the future for your health. And this is actually a therapeutic thing. I believe he has tips on showing you how to do it at home with a tool that he may provide with you. And you guys can just go take make your decisions from there and just go about the videos and just be thorough about it.
So we're going to do the hiatal hernia technique or maneuver on him right now, but I want to go into what he's dealing with, right? Really bad acid reflux, and in the middle of the night just shoots up and, GERD, reflux disease, gastroesophageal reflux disease. Many of you have it here. It's not all of you do. He has some other symptoms like bloating, and he's afraid they want to do surgery in a couple weeks, and the medication worked for him. It does for a lot of people, but it's not a long-term solution. You're only supposed to be on those meds for 4 to 6 weeks. So that's not a long-term solution. And neither is surgery. The failure rates are so high. I keep saying that, and I watch all these Facebook hiatal hernia groups and paraesophageal and laparoscopic surgery groups, and people are like, I'm excited to get my surgery tomorrow, and yet they've never tried this technique. What a shame. What a shame. This is such a simple technique. It's safe. It's safer than taking one pill of omeprazole. I mean, it's so safe. It's ridiculous not to try this first. So luckily, we treated a friend of his who had acid reflux, GERD, hiatal hernia, and we treated, I don't remember who it was, but how are they doing now?
She's doing much better. She's still trying to avoid surgery. Her doctors are trying to get her to do that. So she's using the technique that you showed her.
The tool. Yeah. So she bought the reflux shield. Some of our older patients don't have that because it wasn't out back then. So what we're going to do is the technique on him. If it's effective, he has a 3.5 centimeter hernia. So that's a medium size, good size, medium size sliding hiatal hernia. And we're going to go ahead and pull that stomach down out of the diaphragm, out of the chest cavity. It's really a simple technique and an effective technique. If you haven't tried this, try it. Okay, now the trick is, who does this technique? That's the hard part. So, by the way, he also has an abdominal hernia here. So that's not related to the hiatal hernia, but that's weakness in the abdominal wall. We're not treating that. We're treating the hiatal hernia, which is an organ hernia up through the diaphragm, okay? So we're about to do that. We finished a quick exam on him. We're about to do that right now. He also had an endoscopy, a couple of endoscopies. But he's afraid to get to surgery because what happens after the surgery? You can't have this done. You can't use my patented device, the reflux shield. So now you're in trouble. What are you going to do? And most of those surgeries fail pretty quickly. Within 5 years. If you're lucky, it's still held after 5 years. But then after the surgery, you can't have carbonated drinks, right? You can't burp. Is that correct?
That's what they told me. That'll be a long-term permanent problem going forward.
Yeah, so no carbonated drinks, no beer, right?
Yeah.
No seltzers, no soda. For some, that's not a big deal, but no belching. I mean, now if you belch a lot, you have a hiatal hernia. We can get that trapped air out and correct that issue, okay? So here's how we do it. We just put a little lotion on the skin. We found the xiphoid process. And tell me when I reach a 5 out of 10 pain level here, okay? And the reflux shield that I created helps you do this on your own, to yourself. It's very, very safe, guys. Okay. Good. So we didn't even reach a 5 there. Let me know when we reach a 5 out of 10. And when using the reflux shield, you don't want to press more than a 5 out of 10 pressure with it. But the reflux shield gives you the leverage to do this to yourself. Otherwise, doing it to yourself, it's very difficult. Some of you may get a little relief when you do it to yourself. If you do, then, but it's not 100%, then you're on the right track. And getting the reflux shield at that point would probably be helpful because you can get that leverage and get in there deeper, okay? And the bigger you are, the deeper you have to get into the stomach cavity to release that phrenoesophageal ligament. And I'm doing a video on that later today. I'm going to shoot a video on the phrenoesophageal ligament and why and how this technique works so well. 93% success rate. Am I at a 5 yet?
Yeah.
Okay. And notice how I lighten up when I get to here. I go to a 4, 3, 2, 1 on a pressure, right? So you'll do that with the reflux shield as well, okay? So this is his first treatment. We're going to chronicle Edwin and just watch him over the next couple of visits. And then we'll give him a reflux shield when he's improving greatly. And sometimes for some people it's immediate. He may have to burp and belch right after he gets off the table. He may have a little explosion of acid reflux right afterwards. That's all normal. It's actually a good sign. And when doing this, sometimes you'll feel like or hear like a slurp or like that's the stomach sliding down. Like a gargle, kind of with your stomach when your stomach growls, that kind of noise. Okay. I haven't felt or heard that yet. And one more here, Edwin. Okay, now we're going to adjust him as well because we had some people come in with hiatal hernias that don't want to be adjusted. Big mistake. Nerve supply to the diaphragm comes from your mid-back. Also, your vagus nerve runs through where the hernia is. As you could see in diagrams we put up, that right alongside the hernia is the vagus nerve. And then the vagus nerve runs alongside the cervical spine and the neck. So cross your arms here. And does that hurt? Do you have a shoulder problem?
No.
You're going to tuck your chin and roll to that side. Yeah. Okay. And now lay on your back and blow all the way out. Deep breath in and blow out. Okay. Relax your arms. So now I just want to check the neck to get any neck pain, stiffness, or headaches.
Yeah, stiffness.
So right here at C2, C3, vagus nerve runs right along here. Just a very gentle adjustment, right? Yeah. Nothing to it. Now look at the difference there in the range of motion. There we go. Okay, now do not come straight up. You're going to roll onto your side. This is the right way to get up if you have a hiatal hernia or a bad back. Roll right onto your side. Yep. Push off your hand and your elbow and then swing your legs down at the same time and push off like that. That's the right way. Great. Now you may have to burp. So see how you feel right now. Breathe, breathe. Don't hold your breath in.
I'm burping.
What's that?
I burp.
You burped a little bit? Yep. Good sign. Feel any different?
Okay.
You're going to have to see into tonight, right? And just go home. Now, do you want to take the reflux shield or do you want to wait and do another treatment on Monday or Tuesday?
I could see how much to drink, what?
It's $119. Typically, we used to say people come in 3 times a week until it's 50% better, and then we go down to twice a week. But now the reflux shield is out. That was before that came out. So you could wait till 25% improvement, and then at that point, take it home if you want.
Yeah, that works.
So let's do one more visit next week, okay? And then at that point, depending on how you are today, and it may hold for all day, for all weekend. It may not. You need to avoid slouching. So I'm going to show you a couple tips. I've done this video a bunch of times. I'm going to show you guys now because a lot of people miss this video. Hold on one sec. Do not use a foam roller. Take a towel the long way, your oldest towel the long way, and you'll fold it 3-fold, right? 1, 2, and then you just roll it up nice and snug. Put a couple rubber bands around it so it's a nice snug roll, okay? A shower towel, guys. And then when you sit, you're going to put it behind your mid-back, not your lower back, your mid-back, where your xiphoid is, right there in the center, your solar plexus at that level. So you come right over here, and I'll show you what that feels like. Go ahead and sit there in the chair. And eventually what you do is you slouch in your desk chair. So sit back. Eventually we end up slouching. Now he's fine, but in an hour he'll be slouching down, especially on the couch. So avoid sitting on your couch, especially after you do this maneuver to yourself, or if you use the reflux shield, avoid sitting on the couch. Sit on a chair like that. You see what that does? It pushes your diaphragm up and out and the stomach down. The stomach is attached to the spine via the anterior longitudinal ligament. That's why I adjusted his spine. Also, nerve supply to the diaphragm muscle comes from the spine. That's why I adjusted his spine. The vagus nerve in the neck, that's why I adjusted his neck. So that's where chiropractic adjustment with the hiatal hernia maneuver can be powerful. So you can try to find a chiropractor that does this. It's rare. It's hard. That's why I created the reflux shield, because I saw a lot of people suffering. So you can do that from home. It comes with directions, video directions. It's easy to use. And follow us so you can follow his story, because we will finish this story. And we will follow up with him on the next visit, 2-3 visits, if that's what we need to do. Thanks for tuning in. Thanks, Edwin.
You're welcome.
Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.